Hello doctors. Today's video is going to be very critical if you are a clinical practitioner. Today we are going to talk about the registration, that is NMR registration. We'll talk it about in detail. Before we begin, this is Dr. Nitin and I help doctors to grow their clinical practice. So if you are new to this channel, please subscribe to this channel uh, and let's get started with today's topic without further delay. So, the National Medical Commission, that is NMC, has implemented a new requirement mandating that all doctors in India they need to register with National Medical Register, that is NMR, to obtain a license to practice in India. So this initiative basically aims to create a comprehensive and authentic database of medical or clinical practitioners in the country. So we'll talk about few key points about NMR, that is National Medical Register. So first of all, it's a mandatory registration. All doctors practicing modern medicine, including those with MBBS, MD, MS, and super specialist qualification, they must re-register on the NMR portal. It's a re-registration. So this requirement applies to even those who are already registered with the Indian Medical Register, that is IMR. It will create basically unique identification number, that is UID. So upon registration, each doctor will be assigned a unique NMR ID linked to their Aadhaar number, ensuring the authenticity of their identity. Then the next critical step is the registration process. There are few required documents. Every doctor must prepare the following documents for the registration purpose. First, a digital copy of their MBBS degree certificate. Basically, the registration certificate from their respective state medical council or the Medical Council of India. Then, their Aadhaar number. Another document is like it is going to be online submission. The registration process is conducted completely online through their portal. After submitting their information, application will be forwarded for verification by the state medical council and again subsequently by the NMC. And how the data management will happen? The NMR aims to consolidate previously scattered data regarding the doctors in India. So this includes tracking those who have left the country or lost their licenses, thus providing a more clear picture of the medical workforce. It will have public access and verification possibility. So certain data within NMR will be publicly accessible while sensitive information will only be available to authorized bodies like the Ethics and Medical Registration Board, that is EMRB, and the state medical councils. There are some future developments. These are planned. The NMC plans to extend their registration system to even paramedics and other healthcare professionals. It will help to enhance the overall digital healthcare ecosystem in India. So this initiative reflects a significant shift towards digitizing healthcare management in India, aiming for a better regulation and authenticity in medical or clinical practice across the nation. So the National Medical Commission, that is NMC, has established this new requirement for all doctors in India to obtain this unique identification number or this UID to practice medicine. So this initiative is basically part of NMC's effort to create a comprehensive national medical register, and this will serve as a more of a centralized repository of information about the registered medical practitioners. So another key features of this include, as I already mentioned, UID registration, creation and registration. Only the EMRB they will have the access to this data, sensitive data. Okay. and it is very essential for registration into this NMR. So this UID will remain with the practitioner throughout their career, even if they move between states. So this NMR, there will be this NMR registrar. This NMR will include details like registration number, name, father's name, date of registration, place of employment, your medical qualifications, specialty, year of passing, and the names of institution from where you have achieved these qualifications or you obtained the qualification. And this register will be publicly accessible via NMC's official website, basically aiming to like increase the transparency and allowing patients to verify the doctor's credentials. Regarding the license renewal, doctors must renew their license every 5 years by submitting application to their respective state medical council. So that will continue. Uh, it should be done 3 months before the expiration of the register. There will be no fee charged by EMRB. There is certain appeal process. If doctor's application for the license or its renewal is rejected, they can appeal to the EMRB within 30 days. So I have also created another video on this similar topic previously also, where I got multiple questions, and I have already answered them, but again I want to say that for your specific queries, you need to check the NMR portal for more details and specific details. Uh, so this appeal must include relevant documentation and if any processing fee is applicable. The EMRB is required to decide on the appeal within 30 days, and if successful, the state medical council must issue the license within 15 days. So what will be the application procedures? So doctors can apply for their license through the online portal, where they must provide specific details, as I already mentioned. That should include your registration number, name, father's name, date of registration, place of work, medical qualifications, specialty, and the year of passing. So the application will be forwarded to the relevant state medical council for the processing within 30 days after the payment of any fees as decided by the state medical council. And the data synchronization will happen. The NMR will synchronize data from state registries in real time, ensuring that the information remains very current and accurate across both the platforms. So this comprehensive systems aims to enhance accountability in medical practice in India while providing the patients with the accessible information about uh, their healthcare providers. So I request all the clinical practitioners particularly to go and register with the NMR if they want to continue their medical practice. So if you have any specific questions, please let me know in the comment section, and I will try to provide as much as details for your guidance. And that's all for now. Maybe if there is any future update on this NMR, I'll again come back with the latest news or any updates regarding this. So this is Dr. Nitin signing out. Bye bye.